Metabolic syndrome is characterized by a group of conditions that greatly increase a person's chance of developing heart disease, stroke, and diabetes. The definition of this syndrome differs among experts. However, they all agree aggressive measures should be taken to treat each disorder associated with it.
Now, metabolic syndrome is getting quite a bit of attention, both in the professional literature as well as in the lay media in recent past. Metabolic syndrome is a cluster of abnormalities that tend to occur in the same people. And by definition, the metabolic syndrome means that you have 3 of the following 5 abnormalities.
The first abnormality is high blood pressure or hypertension. A blood pressure greater than or equal to 130 over 85 millimeters of mercury meets the criteria for hypertension.
The next one is an abnormal level of blood glucose. This may or may not be associated with diabetes, depending on how high the blood sugar is. But this would include a blood sugar that in the fasting state is greater than 100 milligrams per deciliter. And a lot of people do have what we call prediabetes, so not a high enough level to be called diabetic, but high enough that it's no longer considered normal or optimal, and that's an area between 100 and 125. So those are the first 2. The next one is a tendency to carry one's weight around the waist. So it's a waist measurement where a person tends to be kind of apple-shaped rather than pear-shaped. For women, it's a waist measurement greater than 35 inches, and for a man, a waist measurement greater than 40 inches. And so where we carry our weight tends to be probably even more important than what our overall body weight is. The last 2 characteristics are those associated with the cholesterol profile. And the first one is a triglyceride level greater than 150. And the second one is an HDL, or a good cholesterol level, that's less than 40 in men or less than 50 in women. So we have 5 characteristics: hypertension, abnormal blood glucose, an increased tendency to carry the weight around the waist, a high triglyceride, and a low HDL. And any 3 of those 5 qualifies one for metabolic syndrome.